hello at the beginning. My name is Stefan Busnatu. I'm a medical doctor in cardiology, resident in cardiology at the Emergency Hospital Bagdazar from Bucharest. It's a part of the University of Medicine and Pharmacy Cardiovila, one of its hospitals. And here we are involved in a rehabilitation use case scenario. In Romania, speaking, or in Europe, Eastern Europe, the rehabilitation process of patients with cardiac events isn't so developed. And the main idea is that the person aren't taught what to do after they suffer a heart event. That's the motive that the person suffers the heart event, he gets in the hospital, stays for 1 week, after that he goes home, he takes his pills, but he doesn't do anything to change his lifestyle, he doesn't get in any rehabilitation programs, doesn't do any physical exercise, nothing, and after 3 or 4 or 5 months he comes back with another heart problem, with other symptoms, and I don't know, the main problem in cardiac rehabilitation is that the patient, when suffering a heart attack, he becomes very anxious.
And does that happen quite frequently, that people come back after 5 or 6 months and having problems?
Usually the patients at 50, 60 or 70 years, they have all sorts of diseases. All sorts of diseases that if you don't have a proper rehabilitation program, you risk decompensating other diseases, and other diseases being decompensated then trouble the heart. With proper rehabilitation, you manage to get the heart to a proper function. So if other diseases happen, like pneumonia or colds, a simple cold can give problems to the heart. If you manage to have a proper function of the heart, you may pass of other diseases without any problems.
How many percentage of the patients that you are seeing, would you say, are readmitted within 6 or 12 months after their heart attack?
I don't know exactly, probably like 10%.
Do you think that the FI Start project could make a difference to the lives of these people?
Yes, I really think that by training people, teaching them how to do proper exercise, how to properly take their medication, get a good understanding of good nutrition, will get them back as normal as possible in a good or maybe a better life after a cardiac rehabilitation, because it really opens your mind. If you really learn, if you want to learn, it really opens your mind, and maybe you'll have a better life after that.
And do you think that people will be able to cope with the technology? They will be able to use the technology properly?
Depending on the age, I think this is something that probably we'll find out. During this use case, we'll find out if the people can manage. We'll try to teach them, and we'll see if they manage to use the software. We'll try to make the software as usable as we can for them. This is the main idea, to get it useful for everyone.